When withdrawing medication from an ampule, tilt the ampule and place the bevel of the needle in the corner space or shoulder near the opening. Surface tension should keep the solution from spilling. Then, pull the plunger to withdraw the solution. Now, let's look at a device for withdrawing solutions: filter needles. Use filter needles to keep glass or paint chips that may have fallen into the solution from being drawn into the syringe. To withdraw the solution, either use a filter needle and change to a regular needle before expelling the contents, or begin with a regular needle and change to a filter needle before expelling the contents. Either way, the filter needle must not be used for both withdrawing from the ampule and expelling from the syringe. Doing so would nullify the filtering effect. Sometimes a medication may need to be withdrawn from an ampule with a regular needle, so the active ingredient is not filtered out in the process. If the syringe is used as the final container for dispensing, a filter needle should be used to withdraw the solution. Another device you can use for withdrawing solutions from an ampule is the filter straw. The filter straw differs from the filter needle in that it is made out of plastic tubing rather than metal, and it is longer, making it easier to reach the bottom of an ampule. The filter straw also reduces the risk of needle sticks because it does not have a sharp tip. Once the solution is withdrawn with a filter straw, a regular needle must be attached to the syringe to inject the solution into its final container. Medication vials are glass or plastic containers with a rubber stopper secured to the top, usually by an aluminum cover. Vials differ from ampules in that they are used to hold both powders and liquids. Before opening a vial stopper, it must be swabbed with 70% isopropyl alcohol and allowed to dry. The correct swabbing technique is to make several firm strokes in the same direction over the stopper closure, always using a clean swab. Swabbing helps to achieve sterility in two ways. First, the alcohol acts as a disinfecting agent, and second, the physical act of swabbing removes particles. Needle insertion. After swabbing, when piercing vials with needles, avoid coring by first piercing the stopper with the bevel tip, and then pressing downward and toward the bevel as the needle is inserted. Vials are considered closed system containers because air or fluid cannot pass freely in or out of them. In most cases, air pressure inside the vial is similar to that of room air. To prevent the formation of vacuum inside the vial, in other words, less pressure inside the vial than in the room, you should normalize pressure in the vial by first injecting a volume of air equal to the volume of fluid that is going to be withdrawn. Please note, this step should not be done with drugs that produce gas when they are reconstituted or with hazardous medications. Next, we'll discuss powdered drugs. If the drug within a vial is in powdered form, it must be reconstituted. You should inject the desired volume of sterile diluting solution into the vial. Then remove an equal volume of air to prevent positive pressure from developing inside. This is particularly important when dealing with medications that can be harmful if expelled into the air. Air should be allowed to flow into the syringe before the needle is removed from the vial, or use a vented needle, which allows the displaced air to escape. Take care to ensure the drug is completely dissolved before proceeding. Usually, gentle shaking adequately dissolves the drug contents, but if you are unfamiliar with preparation methods for the product, consult the package information or a pharmacist. Some agents cannot be shaken. Solutions require different processes. Vials with drugs in solution are classified as either multiple dose, also called multiple use or multi-dose, or single dose. Multiple dose vials and bacteriostatic water for injection contain a small amount of preservative agent to retard the growth of organisms. This does not make the solution self-sterilizing, and the use of strict aseptic technique is still required. Common substances used as preservatives include benzyl alcohol, parabens, phenol, and benzalkonium chloride. The manufacturer adds these substances in small quantities that are not harmful to patients when dosed appropriately. Therefore, if a preparation calls for large amounts of drug solution that contains a preservative or a diluent with a preservative, you should consult a pharmacist to confirm the total preservative to be administered will not be toxic. Because of their toxicity, solutions with preservatives should not be used for epidural or intrathecal dosage forms and should only be used with caution in pediatric or neonatal preparations. As you know, manufacturers produce a number of products that are packaged in ready-to-inject syringes. Drugs commonly given intramuscularly, intravenously, or subcutaneously are packaged this way to make them convenient and speedy in emergency situations. These products may be used in the pharmacy to prepare sterile preparations, but are more likely to be kept in patient care areas. Let's examine the common steps you will follow to prepare IV admixtures. Keep in mind that the final IV admixture may be prepared in a variety of containers, from flexible plastic bags to glass bottles. Before compounding, assemble all materials and inspect vials, ampules, and IV solution containers for signs of cloudiness, particulate matter, cracks, punctures, expiration dates, and anything that may indicate that the product is defective. Next, ensure all materials are available to complete your tasks. Place only necessary materials in the compounding work area. Then, disinfect all injection surfaces and allow them to dry. Withdraw the drug fluid from its container and measure using the syringe size closest to the volume to be withdrawn. To obtain as accurate a measurement as possible, remove air bubbles from the syringe. Now, assemble the final preparation. Flexible plastic bags are yet another type of container. Flexible bags made of polyvinyl chloride, or PVC, are easy to store, relatively rugged, and eliminate the need to vent when removing fluid. Do not remove the protective overwrap from a PVC bag until it is ready to be used. To minimize air turbulence in the critical area when preparing an IV admixture, the injection port of a PVC bag should be positioned toward the HEPA filter. To add a drug to a PVC bag, insert a needle into the injection port and inject the appropriate volume of drug. Use a needle longer than 3/8 of an inch because the injection port has 2 diaphragms that must be pierced. The outside diaphragm is the outside latex tip. The inside diaphragm, which is plastic, is generally about 3/8 of an inch inside the injection portal. Now let's look at the procedure for adding a drug to a glass infusion container. First, remove the protective cap from the IV bottle. Next, swab the rubber stopper or latex diaphragm with alcohol and let it dry. Finally, inject the drug fluid. To insert needles through rubber stoppers, use the non-coring technique we talked about earlier. Before removing the container from the compounding work area, place a protective seal over the stopper. When using semi-rigid containers such as polyolefin for admixture preparation, you should remove the protective screw cap and add drugs through the designated injection portal. It's not necessary to disinfect the portal or replace the protective cap. When the final preparation being dispensed is not intended for injection, a lure lock tip may be placed on it to maintain sterility. These are attached either by friction or threaded grooves. Lure locks may also be used on syringes prepared for needleless systems. A common method of preparing drugs is adding the drug solution to a small volume parenteral, or piggyback. A small volume parenteral is any IV solution of less than or equal to 100 milliliters. A nurse simply attaches tubing to the piggyback and connects this secondary IV to the primary IV set at the proximal Y site. Flexible and easy administration. The piggyback is placed higher than the primary IV, usually a large volume parenteral, so that gravity causes the drug solution to enter the patient's vein before the primary fluid. The back-check valve at the proximal Y site closes while the piggyback is being administered, preventing the piggyback solution from entering the primary IV. Once the piggyback solution has been infused, the primary IV resumes flowing. There are a number of variations of the basic piggyback concept. Many drugs and doses are available in premixed form. If premixed products are not stable for long periods of time at room temperature, they are often sold frozen and thawed by the pharmacy shortly before being administered. Adding drugs to these solutions is generally not recommended, and most containers do not have an injection port. These solutions are administered and handled by the nurse in the same manner as other piggyback setups. Large volume parenterals, or LVPs, are IV solutions greater than 100 milliliters in volume and usually dilute dextrose or sodium chloride, with or without drug additives. LVPs are usually given as continuous infusions, although they may also be used for intermittent infusions. These preparations may be used in their commercially available form or may have drug additives added in the pharmacy. The home infusion therapy industry's need for technology to improve the patient's quality of life has led to the development of numerous home products. This also saves the infusion companies money. The type and brand of device dictates the type of supplies you will have to assemble for the patient. You should become familiar with the range of infusion products and supplies home infusion companies use to care for their patient population. The 5 types of infusion systems available for home use are mini bag infusion via gravity system, syringe infusion via syringe device, syringe infusion via IV push method, rate-restricted IV administration set systems, and ambulatory electronic infusion pumps. Total parenteral nutrition, or TPN, refers to IV administration of the nutrients needed to sustain life. TPNs contain carbohydrates, proteins, fats, water, electrolytes, vitamins, trace elements, and may also include such drugs as heparin. TPN solutions contain base components and additives. Base components are usually mixed first and make up much of the volume of the TPN. These solutions are generally administered by a pump to maximize safety. TPN therapy is indicated for patients who cannot meet their nutritional needs through oral or other gastrointestinal means. TPNs may be used for patients who cannot, will not, or should not eat, or who cannot absorb enough nutrients to sustain their needs. Procedures for ordering and dispensing TPN solutions vary and are specific to each institution. Many institutions use a standardized TPN ordering form to make orders straightforward, consistent, and patient-specific. Since setup to make just one TPN can be costly, this approach saves time and money by allowing multiple bags to be prepared consecutively. TPN solutions are ordered specifically to meet a patient's metabolic and nutritional needs. An order for central TPN solution might look like this. The preparation of TPN solutions has changed considerably in the past several years. In the past, many of the components had to be prepared from non-sterile powders. Today, most TPN ingredients are available as sterile solutions made by gravity fill or by means of an automated compounding device. First, let's look at the gravity fill method. As the name implies, gravity fill uses gravity to transfer the base components into the final container. While gravity fill uses equipment that is normally part of an IV program, the disadvantages of this method are that it limits flexibility in the volumes of base components used. It takes longer than automated methods, and volumes cannot usually be measured accurately. Let's have a look at the two gravity fill methods for filling bags, the empty bag method and the underfill method. The empty bag method involves starting with an empty sterile bag that will be used as the final container. Commercially available bags have leads that can be connected to bottles or bags containing the base components. This method can be used for either traditional or 3-in-1 preparations. Another method is the underfill method. This method uses commercially available underfilled bags, which are partially filled with concentrated dextrose solution. A bottle of amino acids is connected to the underfilled bag by a tubing set and infused into the partially filled bag. With either method, other components are added by injecting them through an injection port into the final container. This is usually the final step before labeling and dispensing. Take great care, both in technique and accuracy, since the potential for errors is high and their ramifications are serious. Each additive must be in the correct amount. If even one is incorrect, the entire solution must be remade. The pharmacist must check each step. We will now talk about automated compounding devices. Automated compounding devices, or ACDs, are specialized equipment used to prepare the TPN solution. Two primary versions of TPN compounders are available. One version provides a separate compounder for the base solutions and for the electrolytes, while the other version uses one compounder to infuse all the compounded ingredients. In the former, 3 primary pieces of equipment are used, sometimes together and sometimes individually. For example, one computer-controlled ACD prepares the base components, dextrose, amino acids, and possibly fat emulsion and water, while a second networked ACD adds most or all of the additives or other components. The base ACD uses special tubing that can withstand the pumping action of the machine in allocating large volumes of solutions. It accounts for the specific gravity of the solutions being used and weighs the amount pumped into the final container. Some ACDs also weigh the original container from which solutions are pumped and stop pumping when the chosen amount has been added. The base ACD can be used with a computer or used alone. When the base ACD is used alone, you enter the desired volume and specific gravity of the base solution components, and the device weighs the correct amounts. The additives ACD also uses special tubing that delivers exact amounts of the solutions in very small quantities. It weighs the solutions to ensure proper volumes and flushes the line between injections to avoid incompatibility problems. The additives ACD must be used with a computer. The computer controls the system and offers many safeguards. It performs many of the calculations that would otherwise be prone to human error and alerts the user to potential entry errors and inappropriate orders. Alarms are available to detect free-flowing ingredients and air bubbles in the line. The final preparations are checked by comparing the anticipated final weight of the preparation against the actual final weight of the preparation. Variances of more than plus or minus 3% are not accepted. The accuracy provided by the ACDs cannot totally substitute for all checks in ensuring the quality of the preparation. Additional safeguards must be built into each step of the TPN ordering, preparation, and administration process. Calculations should be verified, and solutions and their ingredients should be double-checked, regardless of the system used. ACDs are used inside the laminar airflow workbench and must be cleaned daily according to the manufacturer's instructions. These systems require routine maintenance and calibration to ensure accurate compounding. To minimize the potential for errors, the compounder should be observed during operation. Quality control procedures may be implemented to verify final contents of the preparation. Now, let's look at the administration of TPN solutions. Most TPN solutions are made for administration through a central line. This route is used because it results in immediate dilution and high concentration. Administering 2,000 to 3,000 milliliters of concentrated TPN solution can allow a medical team to completely meet an adult patient's daily nutritional needs. Occasionally, parenteral nutrition is administered through a peripheral IV line. Peripheral parenteral nutrition, or PPN, can contain many of the same components as TPN. However, to be administered peripherally, the PPN admixture may not be as concentrated or have as high an osmolarity as TPN. Since these solutions are less concentrated, they may not meet the patient's total nutritional needs. Consequently, they are often used either as a nutritional supplement or for short-term nutritional intake. Once a port has been penetrated with a needle, it will need to be properly sealed to reduce the risk of bacterial contamination. The most common seals used are IV additive, IVA seals, which are placed over the sterile port of a vial or final preparation. These seals are made from aluminum and have a sterile pad in the center to ensure sterility. Other closures may include tamper-proof caps that are placed on bottles or IV bags to prevent tampering. Tamper-proof caps are commonly used on IV preparations containing controlled substances to discourage drug diversion once the preparation has left the pharmacy. Injection ports on IV bags are often sealed with metallic adhesive seals in the laminar airflow workbench after an admixture is made. Injectable medications come in a variety of containers. Each storage and delivery method has its own set of procedures. If a contaminated drug or solution is inadvertently injected into a patient, the adverse effects can be fatal. Proper aseptic techniques like swabbing are universal in helping prevent the transfer of microorganisms from container to patient. Technicians and pharmacists work as a team in the preparation environment to ensure the patient receives the right drug in the right amount. When compounding sterile preparations and working with other intravenous admixtures, appropriate caution should be used. Regardless of the size of the facility, everyone must follow the same procedures for mixing a preparation to ensure that the final result is safe and effective. Not all drugs are administered in hospitals. Many admixtures are administered at home. To ensure preparation safety, appropriate labeling and proper training must also be provided to caregivers. Now, stop the program and review Chapter 6 in your workbook. When you're ready to continue, return to the program for Section 7, Labeling. Labeling is the most critical part of any facility's QA process. All preparations must be labeled accurately for safe administration of medicine, and labels should be easy to read and understand. In this section, we'll review labeling. Labels contain the information technicians need in order to compound medication. For the safety and welfare of patients, it's important that correct information be printed on labels. Just as importantly, you must read, interpret, and calculate doses correctly based on that information. Pharmacy technicians may detect errors in an order, on a label, and in other documentation. A pharmacist should always be alerted to suspicious information that a technician has found in an order, on a label, or as part of a medication calculation. Because of the critical nature of the information, each person is responsible for checking the previous person's work. Let's take a look at general labeling guidelines. Drug labeling is required if the preparation is not administered immediately, or if it is administered by someone other than the person who prepared the medication. Labels must conform to all applicable federal, state, and local laws and regulations. In order to ensure proper labeling, follow these guidelines. Type or electronically print medication labels in a standardized format to ensure that they are legible, accurate, and complete. Make sure that the appropriate primary and auxiliary labels are firmly affixed to the container. Use a metric system of measures instead of the apothecary system. Do not use numbers, letters, coin names, unofficial synonyms, and prohibited abbreviations to identify medications, with the exception of approved letter or number codes for investigational drugs. Destroy all medications with illegible or worn labels. Use a uniform systematic labeling method. Fill and label one order or drug preparation batch at a time. Dilutions and labeling should be done in the pharmacy whenever possible. Within the pharmacy, only a pharmacist or authorized pharmacy technician under the supervision of a pharmacist may label and dispense medications, make labeling changes, or transfer medications to different containers. Now, let's review the USP labeling requirements for compounded sterile preparations. With the introduction of the United States Pharmacopoeia's Chapter 797, a minimum labeling standard for all compounded sterile preparations now exists that applies to all healthcare settings, not just pharmacies or hospitals. Here is a sample label showing the USP label requirements. Section 1 includes the names and amounts of the concentrations of ingredients. The name of each drug is clearly shown. This includes the names of all drug products or ingredients added or used to prepare the finished preparation, including admixture solutions and corresponding volumes. While the label information should contain the generic name of the drug, the trade drug name or commonly known name of the preparation can be included if it might reduce the potential for error. Although the amount of admixture solution is usually unimportant in the patient's therapy, it may be a consideration in certain clinical settings. More generally important, the admixture solution affects the compounded preparation stability and beyond use dating. In some cases, it may be appropriate to label ophthalmic sterile preparations with the concentration, not only the active ingredients, but also the preservatives. Moreover, the amount and units of measure should be standard and easily understood. Section 2 displays the total volume of the preparation. The total volume of the preparation is usually expressed in the metric system. For IV piggybacks and continuous infusions, this measurement allows tracking the patient's total fluid intake. If the volume of the admixture solution is not significantly different from the total volume, for example, with antibiotic solutions, these measurements are used interchangeably. For large volume solutions with multiple additives, such as TPN Solutions, use the actual or calculated total volume. For syringes and vials that are overfilled, both the overfill volume and the volume of the prescribed medication dose should be clearly shown on the label. Section 3 includes the beyond use state. The beyond use state is the last state that the preparation can be used by the patient. Beyond use dating should be based on known stability information and sterility considerations. The specific beyond use date of a preparation should be based on published data, appropriate testing, or USP NF standards. Section 4 shows the appropriate routes of administration. Even though the route of administration may be implied by the dosage form, place the appropriate route of administration on the preparation's label. Remember, some drugs can be given only by certain routes, or the amount concentration is route specific. Clearly mark and label preparations used for irrigation, cardioplasia, intrathecal, and epidural injections, and peritoneal dialysis by size, shape, and the use of auxiliary labels. Syringes should be clearly labeled with the intended route of administration. This is critical, as in some cases the ramifications of giving a particular drug or